We have very little, if any, real-time data on COVID-19. And that fact is attached to a story that many of you have asked about this week. So I thought let's take a little time and flesh it out. It's one of those great stories in journalism, too, that has high stakes, but is a little bit like a Rubik's Cube. The more you turn it, the more different sides to the story you see. So the story that you had asked questions about is a big headline regarding how the White House is collecting data related to COVID-19. And depending on where you saw the story, you might see different angles on it. Two major angles surfaced about this story. On the one hand, some are looking at this as a power grab by the White House and by the federal government. On the other hand, some are looking at this as a solution to a problem. So let's take a step back and just kind of do a big overview. One of the things you should know about the CDC is that the CDC is under the Department of Health and Human Services, which is of course under the White House as a part of the federal government. Since the beginning of this pandemic, there's been a lot of struggles with the CDC in collecting data. It started with testing, and we have to remember that the systems that we have in place right now are not necessarily fit for a 100-year event like the one that we're experiencing. We would hope that they would be, but we're really in some unprecedented time as far as testing and data collection. So certainly the systems have been tested. The CDC has always said that they are not the best source of information. They have directed you, the public, to turn to your local officials because that's where they say the more accurate, more up-to-date information will be. And the last thing is that I have listened to hours and hours of congressional testimony over the last several weeks. I do it while folding laundry and cleaning the kitchen. I highly recommend it. It's actually a great way to pass the time because it is hours of information. And repeatedly in this testimony with some of the nation's top health officials, there is a request to Congress for more money, more of your taxpayer money, to go to building better data collection systems. The problem is if you don't have real-time data, you can't make decisions with the most up-to-date information. And what health officials are saying is we are having to make real-time decisions, but we don't have the most critical information at that moment. So this is really important to know all of those things. The White House came out this week, really, I should say the Department of Health and Human Services came out this week and said, we are actually going to start collecting data differently. Data that was going to the CDC, we are going to take directly into this department, and we're going to use a private technology company to help us compile the data. The data that they're talking about is specifically regarding hospitals and ICU beds, equipment, things like that are related directly to the hospitals. The CDC will continue to collect deaths and cases. So it's not that the CDC is not collecting any data, but it's this portion of the data that the Health and Human Services is going to look at, and they're going to be using a private technology company. This has also sparked some questions. What you should know about this technology company is that they have worked with the government before. Some of their contracts date back to 2004. So it's not a new technology company to the federal government. So here are the different sides to this story. And what the federal government is saying, and Health and Human Services, is that we need more efficient, quicker data. Why? Because with specifically equipment, ICU bed, hospital capacity, the federal government is being asked to step in and supply some of these items. If we don't have up-to-date information, we can't green light that. And we don't think we have the best information. Hospital officials are saying, wait a minute, we're doctors on the front line, and we've been using this system for 15 years, reporting to the CDC. It's worked fine for us. It's transparent. We think it's efficient. We're not seeing major challenges with it. We don't want to suddenly have to change the way we're reporting. But the federal government is requesting it. The CDC director that was previously, remember the CDC was previously in charge of this, is saying he believes that this will be helpful. A different CDC official talking to NPR, and this official is more in charge with the database data collection, is saying, why are we changing this now? It has worked for us. So there's a lot of different sides to this story. What will happen eventually and whether or not it'll be effective, time will tell. But we should know that this is an issue that's come up regarding this event, which we're all experiencing, which is of course the pandemic. And so how exactly we solve it and whether or not we should be trying to solve it now is a big question. The larger kind of like, this is the big philosophical question we'll be asking over the next, several years is what is the appropriate role for the government in healthcare? Does government healthcare work in times of crisis and on a regular basis? And we're actually experiencing some real life scenarios about whether or not that works or not. So curious your questions about that. That's what's going on. So again, it's being framed in a lot of different ways. Some are accusing the Trump administration of trying to take the data, and there's questions about transparency. You have, the other side being like, hey, this might be actually really helpful to us and how we're divvying out supplies. So that's what you should know about this story. I think there's another side of it that we're also not completely considering, which is security. I mean, the databases that we're trying to build are critical not only for our decisions here, but it's a lot of really important information. And we have a couple of headlines just over the last 24 hours that are reminding us about how important technology security is. You had a major hacking event for Twitter yesterday. And also we have some news this morning that Russian hackers are trying to hack into healthcare companies that are dealing with vaccine research in COVID-19. Both of these stories are still developing. There's a lot to look at for them, but you should know what's happening. And that's a whole other angle that we haven't talked about. So hope this is helpful. Real quick, I know a lot of you had a lot of strong opinions about masking and the recent study that was being profiled by the CDC. We should be really clear about this, that when it comes to science about masking, we are looking a lot at association, not necessarily cause and effect. We're doing this and it's leading to this. And one of the reasons for that, why we can't have all the perfect controls in place for this science, is because it's very difficult to replicate real life in a lab. And a lot of times scientists are not using even the real coronavirus because also security. We don't want to let any of that out. So you should know that that's important about masking data. The more data we are seeing compiled, comparing nations with masking requirements, nations that don't, communities that have it, and communities that don't, it is leading to an association that is helpful in the transmission of the virus. But a perfect control study for this, specifically mask wearing and all the different scenarios that you are going to experience in real life, you should know it does not exist right now, at least from what I can see, and I'm looking at all of it, but the association is growing stronger. And that's kind of the big takeaway as we're looking at masking policies. In a lot of ways, I looked at the case study yesterday, just from a personal point of view. I know it's difficult. I don't love wearing masks all the time. I don't know if anyone loves it, but based on our previous reporting, and I'll link back to that story so you can see it. We did an interview with someone that led a mass study that was outside of the government. It was really fascinating about how he compiled information. His main takeaway was, if you wear a mask, and this was a couple weeks ago, you can really go about your daily life. And it's a way that governments and economies don't have to shut down. That was his takeaway. And when I'm looking at some more of this data, I think that's something to consider. How do we make sure that we can go back to doing the things that we love to do? And for right now, masks may be what's required to, again, blunt the transmission. Time will also tell. It's tough being in the middle of a 100-year event and not even being 6 months into it. We'll be 6 months next week. So we're so new. Final quick thought, just want you guys to know about this. Did anyone read The Magical School Bus when you were young? It would be about this school bus that got to do all this exploration. The author of that book series passed away. And it's a delightful series if you have kids and you want to read something kind of science-based. It's a way of bringing science to children. It was really, really popular. The Magical School Bus is going to become a movie, actually, as well. So, I don't know, I guess we could look forward to that. Why not? At this point, I think all of us wish that we had science degrees. So we'll start them young. Questions, comments, let me know, you guys. Always love hearing from you. We want to make sure that we're providing the best information for you. Smarter news, when it matters and why it matters. Have a great day, guys. I'll talk to you later.